If you're over 60 and you've ever sat in a doctor's office waiting for your blood pressure results, you know that moment of quiet anxiety. The cuff squeezes, the machine beeps, and then someone reads out two numbers. Most people hear those two numbers and think they know what they mean. But here's what I want to tell you today, and I want you to really hear this. There is one of those numbers that is almost always overlooked, almost always misunderstood. And for people over 60, it may be the most important piece of information about your heart health that you're not paying nearly enough attention to. I've spent a great deal of time studying cardiovascular health, and one of the things that genuinely concerns me is how many people walk out of medical appointments without understanding what their blood pressure numbers are actually telling them. They hear, your blood pressure is a little high or you're borderline, and they nod, pick up a prescription if one is offered, and go about their life. But nobody stops to explain which number is doing the talking, why it matters specifically for someone your age, and what you can actually do about it starting today. That changes right now. In this video, I'm going to walk you through everything you need to understand about blood pressure after 60 dollars, the number that most people ignore, why it becomes so critically important as you age, what the science actually says, and the real practical steps you can take to protect your heart, your brain, and your overall quality of life. Before I get into all of that, I want to ask you something, and I genuinely want your answer in the comments below. When was the last time you checked your blood pressure at home? Not at the doctor's office, at home, on your own, on a regular basis. And when you looked at those numbers, did you know what both of them meant? Leave your answer down below because I read those comments and it helps me understand where most people are starting from. Now let's get into it. When your blood pressure is measured, you get two numbers. The top number is called the systolic pressure. The bottom number is called the diastolic pressure. For most of your life, you've probably heard that you want both of those numbers to be in a healthy range, something like 120 over 80 being the classic benchmark that most people are familiar with. And for much of your younger adult life, doctors tended to focus on the diastolic number, that bottom number, as the most important warning sign. High diastolic pressure was seen as the red flag that needed the most attention. But here is where things get really interesting and really important for you if you're over 60. The research over the last 2 to 3 decades has shifted dramatically. And what scientists and cardiologists have come to understand is that for older adults, the top number, the systolic number, is actually far more predictive of serious cardiovascular risk. It is the number you should be watching most carefully. It is the number that, when elevated and left unaddressed, quietly drives up your risk of heart attack, stroke, kidney disease, and cognitive decline. And it is the number that far too many people over 60 are either not tracking, not taking seriously, or not managing effectively. Let me explain why this matters so much more after 60 than it did when you were younger, because the explanation is genuinely fascinating. And once you understand it, you'll never look at that top number the same way again. As you age, your arteries naturally change. This is not something that happens because of poor choices necessarily. It's a biological process that affects virtually everyone. The walls of your arteries, which in your younger years were flexible and elastic, begin to stiffen over time. Think of it like a rubber band that's been sitting in a drawer for 20 years. It was once stretchy and resilient. Now it's harder, less pliable, and if you stretch it too far, it might snap. Your arteries don't snap, but they lose that beautiful elasticity that used to help them absorb and buffer the pressure wave that comes with every single heartbeat. When your heart pumps blood out into your arteries, it creates a pressure wave. In a younger person with supple, elastic arteries, that wave is cushioned. The artery walls flex and absorb some of that force, keeping the pressure from spiking too dramatically. But in older arteries that have become stiff, there's no cushioning. That pressure wave hits the walls hard, and the systolic pressure, that top number, climbs higher than it would in a younger, more elastic system. This is why isolated systolic hypertension, which means your top number is too high while your bottom number might actually be normal or even low, becomes so incredibly common after 60. Studies suggest that more than 60% of people over the age of 60 have some degree of elevated systolic pressure. More than 60%. That's not a rare condition. That's the majority. And yet it remains persistently undertreated and underappreciated, in part because for so long, the medical world was focused on that bottom number. So, what number should you be looking at? What is the threshold that should have you paying close attention and taking action? Current guidelines from major cardiovascular organizations suggest that a systolic blood pressure, that top number consistently at or above 130 millimeters of mercury, warrants attention and potentially intervention. A reading consistently at or above 140 is considered stage 2 hypertension and is a clear signal that something needs to change. For older adults specifically, having a systolic pressure that regularly sits above 150 is associated with significantly elevated risk of serious cardiovascular events. We're talking about a meaningfully higher chance of stroke, heart failure, and cognitive decline. Now, I want to be careful here because blood pressure is nuanced and context matters enormously. A single high reading doesn't tell the whole story. Blood pressure fluctuates throughout the day based on stress, activity, hydration, caffeine, posture, even conversation. What matters is the pattern. What matters is what your blood pressure is doing consistently over time across multiple readings taken in a calm, rested state. That's the information that tells a real story about your cardiovascular health. This is exactly why I encourage everyone over 60 to have a reliable blood pressure monitor at home and to use it regularly. Checking your blood pressure only when you're sitting in a doctor's office gives you an extremely incomplete picture. Many people experience something called white coat hypertension, where the stress of being in a medical setting temporarily elevates their readings. Others experience the opposite, where their pressure is actually higher at home during daily activities than it appears in the clinic. Without home monitoring, you're essentially flying blind for the vast majority of your life. The ideal approach is to check your blood pressure at roughly the same time each day, ideally in the morning before you've had caffeine or strenuous activity, and again in the evening. Sit quietly for 5 minutes first. Rest your arm at heart level. Take two readings a minute apart and average them. Keep a simple log, even just a piece of paper or a note in your phone, and bring that log to your doctor appointments. This is one of the most powerful proactive things you can do for your cardiovascular health, and it costs almost nothing. Now, let me talk about why an elevated systolic number is so dangerous for your brain, because I think this is the piece that most people don't hear enough about, and it's genuinely sobering. Your brain is one of the most blood pressure sensitive organs in your body. It requires a constant, precisely regulated flow of blood to function properly. When systolic pressure stays elevated over time, it damages the tiny blood vessels inside the brain, the small, delicate capillaries and arterioles that supply oxygen and nutrients to your brain tissue. This damage accumulates slowly and silently. You don't feel it happening. There's no alarm that goes off, but over months and years, the effects compound. The result can be what researchers call white matter lesions, areas of the brain where the tissue has been subtly damaged by poor blood flow and pressure related stress. These lesions are associated with slower cognitive processing, difficulty with memory and recall, problems with attention and concentration, and over time, a meaningfully elevated risk of vascular dementia. Study after study has shown a clear connection between uncontrolled systolic hypertension and cognitive decline in older adults. This is not a minor or theoretical concern. This is one of the primary drivers of age related dementia that is actually modifiable. You can do something about it. And that's the message I most want you to take away from this section. Elevated systolic pressure is not just a heart issue, it is a brain issue. Every year that it goes unaddressed is another year of cumulative damage to the most complex and precious organ you have. Getting this number under control is one of the most important investments you can make in your long term cognitive health. Let me now walk you through the factors that most commonly drive systolic pressure up in people over 60 because understanding the drivers gives you power over them. The first and perhaps most significant driver is arterial stiffness, which I already described. This is partly age related and partly influenced by lifestyle, chronic inflammation, poor diet, physical inactivity, and decades of oxidative stress all accelerate arterial stiffening beyond what age alone would cause. This means that even though some degree of stiffening is normal with age, your choices have real power to slow that process, and even in some cases, partially reverse it. The second major driver is salt sensitivity, which tends to increase with age. When you were younger, your kidneys were remarkably efficient at excreting excess sodium. As you age, that efficiency declines. Sodium that your younger self would have easily eliminated now stays in your system longer, drawing water into your bloodstream and increasing blood volume, and with it, blood pressure. The relationship between sodium intake and systolic pressure becomes stronger and more direct as you get older. This means that dietary changes that might have had modest effects in your 30s can have substantially larger effects now. The third driver is the renin angiotensin aldosterone system. And I know that's a mouthful, so let me just explain what it does. This is a hormonal system that your body uses to regulate blood pressure and fluid balance. As you age, this system can become dysregulated, leading your body to retain more sodium and water and to constrict blood vessels more than it should. Many of the most effective blood pressure medications work by targeting the system precisely because of how influential it is, especially in older adults. The fourth driver is chronic low grade inflammation. This is one of the most underappreciated factors in cardiovascular health in older adults. Inflammation damages the inner lining of your blood vessels, the endothelium, making them less able to dilate and respond to changing blood flow demands. Inflamed, damaged endothelium also becomes more prone to the buildup of plaque, which further stiffens and narrows the arteries. The result is a compound effect where inflammation and arterial stiffness feed each other, progressively driving systolic pressure higher. The fifth driver is sleep quality. This one surprises many people, but the science is very clear. Poor sleep, whether due to insomnia, sleep apnea, or simply insufficient hours, is directly linked to elevated blood pressure. During healthy deep sleep, your blood pressure naturally dips lower, giving your cardiovascular system a period of relative rest and recovery. When sleep is fragmented or shortened, that nightly dip doesn't happen, and your arteries and heart miss that crucial recovery window. Over time, this contributes meaningfully to chronic hypertension. Sleep apnea, in particular, is strongly associated with elevated systolic pressure and is dramatically underdiagnosed in people over 60. Now, let's talk about what you can actually do, the specific evidence based actions that can meaningfully lower your systolic pressure and protect your heart and brain. I want to be clear, these are not vague lifestyle suggestions. These are interventions that have been studied in clinical settings with measurable, significant results. The first and most impactful is regular aerobic exercise. This is not optional if you're serious about managing your blood pressure. Study after study has shown that consistent aerobic activity, walking, swimming, cycling, dancing, whatever you genuinely enjoy and will stick with, can reduce systolic pressure by anywhere from 5 to 15 millimeters of mercury. That is a reduction comparable to what many blood pressure medications achieve. The key word is consistent. A walk you take 3 times a week for 20 to 30 minutes, sustained over months, changes the biology of your arteries. It encourages the production of nitric oxide, which helps blood vessels dilate and stay flexible. It reduces inflammation. It improves the heart's efficiency. It's one of the most powerful cardiovascular medicines in existence, and it's free. If you've been sedentary for a long time or have existing health conditions, please work with your doctor to find a safe starting point. The goal is not to go from zero to running a marathon. The goal is to move your body regularly in ways that elevate your heart rate moderately and make you breathe a little harder than normal. Start where you are. The benefits accumulate even from modest beginnings. The second intervention is dietary sodium reduction. For people over 60, this can have an especially pronounced effect given the increased salt sensitivity I mentioned earlier. The goal for most older adults with elevated blood pressure is to keep sodium intake below 1,500 milligrams per day. Now, that might sound low, and if you eat any processed or restaurant food regularly, you may be getting 2 to 3 times that amount without realizing it. Canned soups, deli meats, bread, condiments, frozen meals, these are the hidden sodium landmines in the modern diet. Reading labels and cooking more of your own food from whole ingredients is one of the most effective dietary changes you can make for your systolic pressure. The third intervention is adopting the DASH diet, dietary approaches to stop hypertension. This is one of the most well researched dietary patterns for blood pressure management, and it works particularly well for older adults. The DASH diet emphasizes fruits, vegetables, whole grains, lean proteins, low fat dairy, nuts, and seeds, while limiting sodium, saturated fats, red meat, sweets, and alcohol. Clinical trials have shown that following this pattern consistently can reduce systolic pressure by 8 to 14 points. That's meaningful. And the same foods that help your blood pressure are also anti inflammatory, supportive of healthy weight, and protective of cognitive function. It's a pattern that works on multiple fronts simultaneously. The fourth intervention is increasing your potassium intake. Potassium and sodium work in opposition in your body. Potassium helps your kidneys excrete excess sodium and helps relax blood vessel walls. Most people over 60 are getting far less potassium than they need. Foods rich in potassium include bananas, sweet potatoes, avocados, leafy greens, beans, lentils, and yogurt. Simply adding more of these foods to your daily diet while reducing sodium creates a double benefit for your blood pressure. If you take any medications that affect potassium levels, check with your doctor before significantly changing your intake. But for most people, eating more potassium rich whole foods is both safe and highly beneficial. The fifth intervention is stress management. And I say this not as a platitude, but as a physiological reality. Chronic psychological stress activates your sympathetic nervous system, your fight or flight response, which constricts blood vessels and raises heart rate and blood pressure. In the short term, that's a useful survival mechanism. But when stress is constant and the nervous system never gets to switch off, blood pressure stays persistently elevated. Practices that activate the parasympathetic nervous system, your rest and digest response, have measurable effects on blood pressure. These include slow, diaphragmatic breathing, meditation, yoga, time in nature, and simply having regular social connection with people you care about. A study published in a major cardiovascular journal found that practicing slow breathing techniques for just 15 minutes per day resulted in meaningful reductions in systolic pressure over several weeks. This is real, measurable physiology, not just a wellness trend. The sixth intervention is managing your weight because excess body weight, particularly excess abdominal fat, is strongly correlated with elevated systolic pressure. Fat tissue, especially visceral fat around the organs, is metabolically active in ways that promote inflammation, insulin resistance, and hormonal changes that drive blood pressure up. Even modest weight loss, as little as 5 to 10 pounds, can produce a noticeable reduction in systolic pressure for people who are carrying extra weight. You don't have to achieve an ideal body weight to see benefits. Every step in the right direction counts. The seventh intervention involves alcohol. If you drink alcohol regularly, even moderately, it may be contributing to your elevated systolic pressure more than you realize. Regular alcohol consumption raises blood pressure in most people, and the effect becomes more pronounced with age. Current evidence suggests that even 1 to 2 drinks per day can elevate systolic pressure by several points in older adults. This is a conversation worth having honestly with yourself and with your doctor. Now, I want to speak directly to those of you who are already on blood pressure medication. Please don't stop taking your medication because of anything you see in this video. Medication and lifestyle changes are not opposites, they work together. In fact, the lifestyle interventions I've described can make your medications more effective and may, over time, allow you and your doctor to discuss whether your dosage needs to be adjusted. But that conversation happens with your doctor based on your individual readings and health history, not based on a YouTube video. What lifestyle changes do is give your medications the best possible environment to work in, and they address the underlying drivers of your blood pressure in ways that medication alone often cannot. For those of you who are not yet on medication and are seeing elevated systolic readings, the lifestyle changes I've described are genuinely powerful first line interventions that deserve a real commitment, before assuming medication is the only path forward. Many people are able to bring their systolic pressure back into a healthy range through consistent lifestyle modifications alone. But again, work with your doctor, monitor your numbers, set a timeline for reassessment. Don't just hope things are improving, measure them. Let me also talk about something that doesn't get nearly enough attention in conversations about blood pressure in older adults: orthostatic hypotension. This is a condition where your blood pressure drops significantly when you stand up from sitting or lying down, causing dizziness, lightheadedness, and sometimes fainting. In older adults, this can actually coexist with high systolic pressure, which seems paradoxical but is actually fairly common. Your pressure might be too high when you're sitting and then drop too sharply when you stand. This is one reason why blood pressure management in older adults requires more nuanced monitoring than simply looking at one number taken in one position. If you ever feel dizzy or lightheaded when you stand up, mention this to your doctor specifically. It matters for how your blood pressure should be managed. I also want to touch on the connection between blood pressure and kidney health because it's a relationship that operates in both directions. High systolic pressure damages the small blood vessels in the kidneys, gradually impairing their ability to filter waste from your blood. Over time, this can lead to chronic kidney disease. But damaged kidneys also lose their ability to regulate blood pressure effectively, which causes blood pressure to rise further. It's a vicious cycle that, once established, can be very difficult to break. Protecting your kidneys and protecting your blood pressure are the same project. Early intervention, before kidney function has been significantly compromised, is far more effective than trying to manage the cycle once it's entrenched. I want to close by bringing this back to the personal level, because everything I've shared today only matters if it moves you to take action. You have more influence over your blood pressure, and by extension, over your heart health, your brain health, and your quality of life than you may have been led to believe. The number at the top of your blood pressure reading is not a verdict. It is information. It is a message from your body about what is happening inside your arteries and your cardiovascular system right now. And like any message, it gives you the opportunity to respond. If that number is elevated, the response is not panic. The response is a clear eyed commitment to making changes, to monitoring consistently, to moving your body, to nourishing yourself with foods that support your arteries, to managing stress, to sleeping well, and to working closely with a healthcare provider who understands the specific needs of your body at this stage of life. You deserve to be healthy. You deserve to have the energy and the physical capacity to do the things that matter most to you. And taking your systolic blood pressure seriously, understanding what it means, watching it carefully, and acting on what it tells you is one of the most direct and powerful ways to protect that quality of life for years to come. So here is what I want you to do right now before you close this video. Check your most recent blood pressure reading. Look at the top number. If it's consistently above 130, make an appointment with your doctor this week, not next month, this week. If you don't have a home blood pressure monitor, put it on your list to get one. They're inexpensive and widely available, and they will give you information about your health that nothing else can. And if you found this video genuinely helpful, share it with someone over 60 who you care about, because chances are very good that they need to hear this too. I'll say it one more time. The top number matters enormously. Don't ignore it. You are worth paying attention to.